Most people turn their backs on the toilet and simply flush. But the truth is, every time you urinate, your body is giving you a real-time lab report. It's your internal plumbing system telling you, here's my report for today on your hydration, your diet, and the function of your liver and kidneys. Hi everyone, I'm Manuel Granada, a specialist in senior care and wellness, and today we're going to become detectives of our own health. We're going to talk about one of the easiest to use, free, and immediately accessible diagnostic tools you have, your urine. If erectile dysfunction is the canary in the mine for the heart, the color of your urine is the daily report card of your metabolism. Ignoring it is ignoring your personal physician. Today, I present to you the ultimate visual guide to urine color. In this video, we're going to understand the science behind the color, learn to detect important additional symptoms, breaking down, color by color, what your body is telling you. Most importantly, offering a roadmap of detailed, scientific solutions for each problem. I want you to start looking at the toilet before you flush today. Let's begin listening to our bodies. The science behind the color. Why is it yellow? Before we get into the visual guide, we need to understand the process. What exactly is urine? Urine is the final product of the blood filtration process that occurs in the kidneys. It is 95% water, and the other 5% is metabolic waste, urea, creatinine, salts, and electrolytes. Urine serves to get rid of toxins that, if they accumulated, would poison us. The key pigment, urobilin. The characteristic color, that yellow we all know, doesn't come from anything we eat directly, but from an internal process. It comes from a pigment called urobilin. Urobilin is produced when your body recycles old red blood cells. Red blood cells contain hemoglobin, which breaks down into bilirubin. This bilirubin travels to the liver and is processed. Part of this process results in urobilin, which is excreted by the kidneys. The rule of concentration. Urine color is a simple rule of concentration. High water content plus low urobilin content. Pale, almost clear color. Low water content plus high urobilin content equals dark, amber, or deep orange color. This makes urine our most reliable hydration monitor. But it's not all about hydration, and that's where we get into the crucial details. 2. Detecting additional symptoms. Beyond color is only one part of the picture. To get a complete diagnosis from home, you have to be a good observer. There are 3 additional symptoms that, combined with color, will tell you if you need to see a doctor. 1. Odor. Normal urine has a faint, slightly ammoniacal odor. However, 3 odors are alarming. Strong ammonia or rancid odor. This usually indicates severe dehydration or an excess of protein or B vitamins. Sweet or fruity odor. Alarm. This odor results from the excretion of ketone bodies. It is a classic symptom of undiagnosed or poorly controlled diabetes mellitus, diabetic ketoacidosis. Fish or foul odor. Typical of a urinary tract infection or, in very rare cases, of the metabolic disorder called trimethylaminuria. 2. Clarity, turbidity, and foam cloudy, milky. Urine. If the urine is opaque, it may be due to the presence of mucus, crystals, fat, lipuria, or, more commonly, pus and white blood cells due to an infection, cystitis, pyelonephritis. Foamy, persistent. Urine. Foam that doesn't disappear quickly, like beer foam, is not normal. The foam is due to proteinuria, or protein excretion. If there is protein in your urine, it means the filters in your kidneys, glomeruli, are damaged. This is a symptom of chronic kidney disease. 3. Frequency and pain. Frequency. Nocturia. Urinating more than 8 times a day and more than 2 times at night may indicate diabetes, an enlarged prostate, BPH, or an overactive bladder. Dysuria. Painful urination. A burning or stinging sensation almost always indicates an active infection. 3. Detailed visual guide. What each color means, based on scientific understanding. Now, let's analyze the color spectrum, from lightest to darkest, and its medical meaning. 1. Clear or crystalline. Alarm for excessive urine. Hydration overload. The body has diluted the urobilin so much that no pigment remains. If your urine is clear, it doesn't mean I'm perfectly hydrated. It means I'm drinking too much water. Study and warning, hyponatremia. Drinking excessive water dilutes the body's electrolytes, especially sodium. The kidneys work overtime to expel the excess. In extreme cases, this can lead to hyponatremia, a dangerous condition that causes brain swelling, mental confusion, seizures, and even death. It is common in endurance athletes who drink pure water without electrolytes. Urine should have color. 2. Pale yellow, the ideal color. Optimal hydration. perfect balance between water and urobilin. This is the goal. Straw yellow or pale yellow indicates that you are replacing the water you lose, that your kidneys are functioning well, and that your electrolytes are balanced. Congratulations, keep it up. 3. Bright yellow, golden, or amber, dehydration. Moderate dehydration, high concentration of solutes, urobilin, urea, and salts. If your urine resembles maple syrup, you are dehydrated. Your body is in water-saving mode, concentrating the urine to retain as much fluid as possible. This is common upon waking or after intense exercise without fluid replacement. If it is constant, it may indicate that you are not drinking enough during the day, or that you have a fever. 4. Bright orange, medications or liver. Medications, B vitamins, drug excretion, e.g. phenazopyridine, rifampicin. High bilirubin, sign of jaundice, liver or gallbladder problems. Here, there is a double concern. Pharmacological cause. Many medications can turn urine bright orange, such as phenazopyridine, used to relieve the pain of urinary tract infections, or some antibiotics like rifampicin. High doses of B vitamins, especially B2, riboflavin, can also produce a fluorescent color. Pathological cause, liver. If the urine is dark orange and you are not taking vitamins, it could be a sign of excess bilirubin in your blood. This is an indication of jaundice and suggests problems in the liver, hepatitis cirrhosis, or bile ducts, gallstones. If accompanied by yellow eyes and itching, it is a medical emergency. 5. Pink or red, hematuria, total stop. Hematuria, blood, presence of red blood cells, erythrocytes. Red urine should never be ignored. The presence of blood, hematuria, is the main cause of this color. Crucial studies, hematuria can be macroscopic, visible, like this color, or microscopic, detectable only in the laboratory. The causes are serious and require immediate investigation. Kidney stones, the most common cause of hematuria with pain, renal colic. The stone tears the ureter. Severe infections, hemorrhagic cystitis, urothelial cancer. Bladder and kidney cancer is the most concerning cause. Hematuria, especially if painless, is a warning sign of cancer. Dietary differences. It is vital to ask yourself, did I eat beets or rhubarb in the last 48 hours? These foods contain pigments, beta-cyanins, that are not metabolized in everyone and can color the urine. If red urine persists, or if you did not eat these foods, consult a urologist immediately. 6. Blue or green, medications or rare. Medications, dyes used in procedures or specific drugs, e.g. indomethacin, propofol. Rare genetic, benign familial hypercalcemia, blue diaper syndrome. Although it may seem like science fiction, it is real. Common causes. It is almost always caused by contrast dyes used in medical procedures or by certain medications, such as the antidepressant amitriptyline or the sedative propofol. Genetic cause. In newborns, it is a symptom of the rare metabolic condition called blue diaper syndrome, where the body does not absorb tryptophan properly. 7. Dark brown or black, the Coca-Cola case. Rhabdomyolysis, severe muscle breakdown, release of myoglobin. Severe liver disease, highly concentrated bilirubin and porphyrins. This color is a medical emergency, especially if the patient has engaged in extreme exercise, marathon, CrossFit, or suffered trauma. Rhabdomyolysis. Damaged muscle releases a protein called myoglobin into the bloodstream, which is toxic to the kidneys and turns urine dark brown. This can lead to acute kidney failure. Other causes. Rare metabolic diseases such as alkaptonuria or advanced melanomas that release melanin. If there is no trauma or exercise, it may indicate serious liver problems. 8. Cloudy or milky with persistent foam turbidity, urinary tract infection, presence of leukocytes and mucus, foam, proteinuria, excess protein. Persistent foam and cloudiness that appears as if the urine contains particles are indicators of filtration failure. Infection. Cloudiness is often pus, dead white blood cells, and bacteria. Kidney failure, proteinuria. Persistent foam means that proteins, which are large molecules, are passing through the kidney filters. The most common causes of kidney damage and proteinuria are uncontrolled diabetes and high blood pressure. 4. The roadmap, detailed solutions and scientific methods. By understanding the color, we can apply specific solutions. It's not just about drinking more water, but about attacking the root of the problem. 1. The solution to dehydration, dark yellow clear. Method, smart hydration and electrolytes. Avoid hyponatremia. For clear water, the solution is simply to reduce water intake to a reasonable level, 2 to 3 liters per day, unless otherwise directed by a doctor. Scientific rehydration. For amber water, it's not just about water. You need electrolytes. Commercial sports drinks often contain too much sugar. A better solution is oral rehydration solution, ORS, or water with a pinch of salt and lemon. The study. A study published in the Journal of the American College of Nutrition emphasizes that rehydration with sodium and potassium improves plasma volume recovery faster than water alone, which is essential if your urine is consistently dark. 2. The solution for the infection, cloudy, foul-smelling method, urine culture and targeted antibiotic. The mistake, taking leftover antibiotics from a previous infection. This leads to bacterial resistance. The correct protocol, urine culture. A sample is collected to determine which bacteria are present and which antibiotics they are sensitive to. Antibiogram, targeted treatment. The urologist or general practitioner will prescribe the exact antibiotic, such as trimethoprim sulfamethoxazole or a quinolone derivative. Preventing recurrence. The underlying causes must be addressed. In men, an enlarged prostate that doesn't empty the bladder completely is a cause of infections. In women, consuming cranberries, rich in proanthocyanidins, helps prevent E. coli bacteria from adhering to the bladder wall. 3. The solution for hematuria, red urine. Method: early detection with imaging and endoscopy. If your urine is red and you haven't eaten beets, it's a race against time and requires the triad of urological diagnostic tests: imaging, CT scan, or renal/bladder ultrasound. To look for stones or masses, tumors, in the kidneys and bladder. Cystoscopy. The most important procedure. A tiny camera is inserted into the bladder through the urethra, under light sedation. This allows the urologist to see the exact source of the bleeding, a tumor, a stone, inflammation, and perform a biopsy if necessary. Urine cytology. The urine is analyzed under a microscope to detect cancerous cells. The science behind it? A study by the American Urological Association, AUA, showed that painless hematuria in men over 50 has a bladder cancer detection rate of over 10%. Acting quickly saves kidneys and lives. 4. The solution for proteinuria, persistent foam. Method: rigorous metabolic control and nephroprotection. Protein in the urine is your kidney's cry for help. Diagnosis: confirmed with a 24-hour urine protein to creatinine ratio. Treating the cause: if the cause is diabetes, you need strict glucose control, hemoglobin A1C below 6.5%. If it is hypertension, specific medications, ACE inhibitors or ARBs, are used that not only lower blood pressure, but also directly protect the kidneys, nephroprotection. Dietary changes: strict reduction of sodium and protein in the diet, under medical supervision, to reduce the workload on damaged kidneys. 5. The solution for drug-induced color, orange-blue. Method: drug consultation and record. Don't panic. If you are taking B vitamins, are being treated for urinary pain, or are on TB treatment, rifampicin, ask your doctor or pharmacist if your urine is changing color. The warning sign: if it is dark orange and you are not taking any medication, or if it is accompanied by yellowing of the skin, jaundice, it is time for a complete liver panel. V. Final summary. Your task from today on. Friends, we have taken a fascinating journey through a simple waste product. We have gone from simple dehydration to the more serious indicators of cancer and kidney failure. I want you to take 3 key messages home. The ideal color is pale yellow, straw-colored. If it's clear, drink less. If it's amber, drink more. The red flag is painless red. It doesn't matter if it's just once. If you see blood in your urine and you haven't eaten beets, see a urologist immediately. Early detection of bladder cancer can mean a complete cure. Persistent foam is not normal. If your toilet bowl looks like a freshly poured beer, it's a sign that your kidneys are letting protein through. Be sure to monitor your blood pressure and blood sugar. Your health is a treasure. Urine is a map to that treasure, showing you where the dangers lie. Don't suffer in silence. Don't guess. Observe. And if the color isn't ideal, or if you experience pain or foam, seek help from a specialist. You are in control of your body. I'm Manuel Granada. If you found this video helpful, please give it a like and subscribe to the channel to continue exploring vitality and well-being for older adults together. See you soon.